We will start with the intradermal injection. It is an introduction of a solution by means of syringe and needle into the superficial layer of the skin. So, hello, I'm Ithea Francesca Murillo, your student nurse from Davao Doctors College, BSN 11K, Group 43. Today, I will be demonstrating the parenteral administration. The first step is to check the doctor's order on the patient chart, and the reason for this is because the chart is more reliable than the medication ticket. The doctor's order on the patient chart and the medication ticket. Prior to performing the procedure, the next step is to introduce yourself to the client and verify the client's identity based on the agency protocol. And next is to explain the procedure to the client and how he or she can participate, and ask if the client has any questions. Afternoon, sir. I'm Ithea Francesca Murillo, your student nurse for today. May I know your name, sir?
Franco.
Can I see your wristband?
Okay.
What's your surname?
Murillo.
Okay, how old are you?
17.
Okay, thank you so much for your cooperation. So, sir, for today, what I will be doing, your doctor, Dr. Stewart, has ordered a penicillin skin test. So that means I'm going to inject a small amount of penicillin to your skin to check if you are allergic or not to a penicillin medication. Is that okay?
Yes.
Sir, may I know if you have any other questions that I can assist you with?
None.
Okay, thank you so much and have a good day. The next step is to perform hand hygiene and observe any infection prevention methods. Next step is to arrange all medication card on a hypodermic tray along with the corresponding drug. The reason for this, by arranging things or your equipment, is to prevent any risk of errors. What I have here is the hypodermic tray, and with all the equipments inside needed for the parenteral administration. So what I have inside: cotton balls, the vial, the alcohol, and the syringe, and also the band-aids. The next step is to choose an injection site with free of lesions and discoloration. And next step is to find a site 3 to 4 finger widths below the anti-cubical space and one hand below the wrist. Then next step is to position the patient's arm on a surface so that his elbow and wrist are flat. So what I have here is this. Step is to apply a clean pair of gloves. As of the moment, I don't have any available, but I have already disinfected and made sure that there is no long nails and no jewelries on my fingers. And the next step is to get an antiseptic swab and clean the site beginning at the center in a circular motion outward about 2 inches or 5 centimeters. Next step is to get the syringe and remove the cap and hold the syringe using your thumb and your forefinger like this of your dominant hand. And next, with the level of the needle pointing up. The next step is to stretch the skin tone of the site of the injection using your thumb and forefinger of the less dominant hand. Pull the needle very close to the patient's skin. Insert it slowly at 5 to 15 degrees angle until you feel the resistance. Advance the needle up to the epidermis about 1/8 inches or 3 millimeter. Slowly inject the medication and feel the resistance until you see a bleb that resembles a mosquito bite will appear on the patient's skin. Withdraw the needle at the same angle that it was inserted and pat dry with a cotton ball. Do not massage the area. Encircle the wheel with blue or black pen and instruct the patient not to rub the wheel or erase the mark. Sir, please don't remove or erase the mark.
Okay.
The next step is to assist the patient into a comfortable position and indicate the site and due time for the reading. Sir, I will assist you laying back. Careful with your... Is that comfortable?
Yes.
The next step, don't recap the needle. Discard the needle and syringe to appropriate receptacle. And wash your hands or disinfect. After doing so, interpret the result after 30 minutes. So for the subcutaneous injection, repeat the step 1 to 4. So the first one is to check the doctor's order on the patient chart because it's more reliable than the medication ticket. Second, when prior to performing, introduce yourself, ask the client for his or her name, and base it on the agency protocol. Next step is to explain the procedure to the client and ask his or her how he or she can participate to the procedure and ask if the client has any questions. Next step is to perform hand hygiene to prevent any microorganisms from spreading. Number 4, arrange the medication to prevent any errors. The doctor's order on the patient chart and the medication ticket. Hello, sir. Good day. I'm Isaiah Francesca Murillo, your nurse for today. May I know your name, sir?
Franco.
And your age?
17.
Okay, thank you so much. So, sir, for today, what I will be doing is subcutaneous injection. I have to inject insulin on this part of your abdomen to control your blood sugar because you have type 1 diabetes. Is that okay with you? Okay, thank you so much for your cooperation. And do you have any questions? Okay, thank you. The next step is to arrange the medication card on a hypodermic tray with the corresponding drug. So, what I have here is the antiseptic swab, my vial, an alcohol, and the corresponding syringes, and aside from that, a band-aid. The next step is to determine which site you'll use for the injection, and next is to shift the patient's bed linen to expose only the potential injection site. And then you have to inspect the area for any bruising, inflammation, and edema. So, checking. So far, the site is clear of bruising and any other factors that may affect our injection site. So this one is clear for injection. The next step is to palpate the site and avoid any area that is tender. To make sure you have the right size needle, use your thumb and forefinger to grasp a skin fold of tissue at the injection site. So like this. Measure the fold from top to bottom and check to ensure that needle is about half as long. Okay, I'll measure. The next step is to place the patient in a comfortable position and ask your patient to relax the site or the area that you're going to inject. Sir, are you in a comfortable position?
Yes.
Okay, I want you to relax your abdomen. Okay. The next step is to apply a clean gloves. As of the moment, I don't have any available, but I have already disinfected my hand and made sure that there are no jewelries and any nail polish or any long nails. So after applying a clean gloves, clean the site with an antiseptic swab in a circular motion starting from the center outwards. Okay, sir, this may be cold. I will apply an antiseptic swab. Center first, starting upwards. The next step is to remove the needle cap by pulling it straight off. And the next step is to hold the syringe between your forefinger and your thumb using your dominant hand as you are holding the dart. Next step is to insert the needle quickly and firmly at a 45 to 90 degree angle. Release the pinch skin. Rest your non-dominant hand on the patient. So quickly and firmly. and release the pinskin and rest it on the patient. Next step is to move your dominant hand at the end of the plunger and slowly inject the medication over several seconds. Retain your grasp on the syringe and keep still. Quickly withdraw the needle. Next step is to quickly withdraw the needle and place a swab or gauze pad on the site and apply gentle pressure but don't massage. I'm applying a pressure. Next step is to place your patient in a comfortable position. Sir, are you comfortable now?
Yes.
Okay. Record the time and amount of the drugs on medication sheet. It was 2:01 in the afternoon p.m. and the site was on the lower abdomen. Insulin. So for the subcutaneous injection, repeat the step 1 to 4. So the first one is to check the doctor's order on the patient chart because it's more reliable than the medication ticket. Second, when prior to performing, introduce yourself, ask the client for his or her name, and base it on the agency protocol. Next step is to explain the procedure to the client and ask his or her how he or she can participate to the procedure and ask if the client has any questions. Next step is to perform hand hygiene to prevent any microorganisms from spreading. Number 4, arrange the medication to prevent any errors. The doctor's order on the patient chart and the medication ticket. Good afternoon, sir. I'm Isaiah Francesca Murillo. And can I see your wristband? May I know your name?
Franco.
Your surname?
Radio.
And your age?
17.
Okay, thank you so much. So, sir, what I will be doing today, your doctor, Dr. Stewart, has prescribed you morphine to alleviate your pain. Is that okay with you?
Yes.
Okay, thank you so much for your participation. Any questions?
No.
Pull the needle very close to the patient's skin. Insert it slowly at 5 to 15 degrees angle until you feel the resistance. Advance the needle up to the epidermis about 1/8 inches or 3 mm. Slowly inject the medication and feel the resistance until you see a bleb that resembles a mosquito bite will appear on the patient's skin. Withdraw the needle at the same angle that it was inserted and pat dry with a cotton ball. Do not massage the area. Encircle the wheel with blue or black pen and instruct the patient not to rub the wheel or erase the mark. Sir, please don't remove or erase the mark.
Okay.
Next step is to select a site for the injection. So valgus lateralis, and then deltoid muscle are possible site of IM injection, which is here. Inspect the area for bruising, inflammation, and edema. If the skin shows bruises or inflammation, use other site. So let me inspect. Clear of bruising, inflammation, and edema. So we are clear to use this site of valgus lateralis and deltoid muscle. Step is to help the patient in a comfortable position, and that will accommodate the injection site you've chosen. Expose only the portion of the body. Sir, is this comfortable enough for you for the injection? Sir? Okay, thank you so much. So, the next step is to apply a clean gloves. As of the moment, I don't have yet any available, but I have already disinfected my hands. And next step is to use an anatomical landmark to find the site of the injection. For ventrogluteal injection, place the heel of your hand over the greater trochanter of the patient's hip with the wrist almost perpendicular to the femur. Point the thumb towards the patient's groin. Point the index finger to the anterior superior iliac spine and extend the middle finger back along with the iliac crease towards the buttocks. The index finger, middle finger, and the iliac crest form a V-shaped triangle. The injection site is in the center of the triangle. The next step is to disinfect the injection site in a circular pattern from inner to the outer for about 2 inches. Inner to outer. The next step is to hold the gauze in your third to fourth finger on your non-dominant hand. So it's like this. The next step is to pull off the cap of the syringe straight off. And hold the syringe using your thumb and forefinger with your dominant hand. The next step is to place your ulnar side on your non-dominant hand just below the injection site and pull the patient's skin laterally about 1 to 1.5 inches. Hold the position until you inserted the needle. If the patient has a little muscle mass, grasp the body of the muscle between your thumb and your forefinger. Use your dominant hand quickly to pierce the needle at a 90-degree angle to the skin, continuing to pull the skin taut with your non-dominant hand. Aspirate the syringe by pulling back the plunger to your dominant hand. If blood appears, pulling it now. If blood appears, you're not in the muscle, remove and discard the needle and syringe and inject the medication slowly at the rate of 1 ml at 10 seconds. Wait 10 seconds and smoothly withdraw the needle. Release the skin and place a gauze pad to the side. Apply a gentle pressure. Step is to place the client in a comfortable position and document the procedure. Sir, let's arrange your position. Is that okay, sir?
Yes.
Okay.